Good afternoon, retired members. My name is Dora Moore, and I'm going to be navigating you through some of your health insurance benefits today. Hopefully, this is going to provide you with the information needed to understand your health insurance and give you some additional information about things that are available with your health care. First, let's talk a little bit about what TRS is. You have a defined benefit retirement plan. This means your retirement benefit is based on a set formula at the time of retirement to determine your lifetime annuity. The main difference with a defined benefit plan and a defined contribution plan, such as a 401k, is with the defined contribution plan, once you have depleted the funds you have paid in, along with the investments and interest earned, your benefits will stop. Therefore, a defined contribution plan may not support a full lifetime for a member. We currently have 74% women and 26% men that make up our retirees. A large percentage of those members are single. With this retirement more than likely being their only source of income and not having Social Security benefits, this is when that defined benefit plan gives more security and comfort for their entire lifetime. One of the main reasons that defined benefit plan is so important to our members is that our teachers are living a lot longer.
Much longer. TRS has more and more retirees over the age of 80 each year. On this chart, as of December 31st, we have 10,480 retirees over the age of 80, and 43 were over the age of 100. TRS offers two health plans for our retirees. The KEHP, the Kentucky Employees Health Plan, is for those under 65 and not Medicare eligible. This is the same plan as what our active teachers, state employees, and classified employees have. So you will have the same insurance in retirement that you had while teaching if you are under 65. There are still 4 plan options for this coverage. The ILMI HP is for our Medicare eligible retirees and those over the age of 65. There is only one plan for these members, as it is exclusive to our TRS members.
What we have to always remember is you are guaranteed the retirement annuity through the inviolable contract. But with your health insurance, you are only guaranteed to have access to group health insurance coverage. The details around that coverage can change. Health insurance costs fall under those things that could change and are not under the inviolable contract, such as the cost of living increase, the 3% factor for years worked over 30, and the high 3 salary average that a member earns for working at least 27 years and being age 55. These are additional benefits you are getting currently, but they are not guaranteed like your annuity. We know two things about health insurance. The cost of insurance typically increases, and what we must pay over time increases as well. But our board and the insurance team works very hard to keep these costs down. One of the major things the Board of Trustees spearheaded was the passing of House Bill 540. This was implemented to help your medical insurance fund become more stable and to share the cost of medical insurance between 4 different entities. If you were teaching in 2010, then you remember when this law was instated. You began gradually paying more contributions over a 5-year period until you were paying an additional 3% in contributions. You moved from 9.855% to 12.855% paid into your retirement. So, the passing of the Shared Responsibility Law called upon our active teachers, employers, retired teachers under age 65, and the state to all share the responsibility of the health insurance cost.
So what that means is everyone pays a share of their insurance to ensure that their insurance remains available for our retirees. This chart shows how everything began and now how it is evened out through 2026 with the spending. This slide shows the impact more than anything else. When we started the shared responsibility in 2010, we were 7.5% funded and facing our members paying much more for their insurance coverage. And today, we are 89.1% funded on the medical insurance side. This has nothing to do with our pension funding. This is only the medical insurance. And this percentage will only increase as long as all parties continue on this track. TRS has worked hard to keep insurance costs low for our members. As you can see on this slide, 16 years ago, Our LMEHP premium was $342 monthly, and in 2026, the premium is $200 monthly. I'm not sure I know of anything that is less today than it was 16 years ago. Most of you do not even see the cost of the LMEHP because you worked the maximum number of years, and along with your entry date, gave you the benefit of having your LMEHP paid for by TRS. If you cover a spouse on the LMEHP, then you will see this premium. If you entered the system later or had less than 20 years, then you may pay a portion of this cost at retirement. If you have questions about your individual costs, please call us at the office and we can get that for you. Once you turn 65 or become Medicare eligible, you will no longer be eligible for the KEHP insurance, but you are now eligible for the Medicare eligible health plan, the LMEHP health insurance. When eligible, the LMEHP consists of the insurer for the LMEHP Medicare Advantage plan changed January 1, 2026 from United Healthcare to Humana. The LMEHP Medicare Part D prescription drug plan is administered by Express Scripts. Coriell Life Sciences, recently acquired by Informed DNA, and the Know Your Rx Coalition are working to make sure the care our members are getting and receiving is the best for them. And of course, our free gym membership program that is now administered by Silver Sneakers. There are some additional features with the Medicare Advantage plan that you receive that are above and beyond what original Medicare covers. I like to compare your benefits to your smartphone. You have so many things that you can access, many rewards you can receive. If you just dig into your Humana benefits, you will find so many things that can help you remain healthy into your golden years. You will now get a $500 discount for each ear for your hearing aids. You will go through True Hearing and they will find a provider in your area. This plan covers a lot of facilities and you should find something in your area that works well for you. Mom's Meals offers 28 meals delivered to your home after you are released from the hospital. You must be admitted to the hospital to receive these meals post-discharge. You also receive one eye exam a year, and your personal emergency response system continues and is paid for by Humana. House Calls is popular with our members and provides someone who will come to your home, go over any health needs, perform a small exam, and discuss your health needs with you. So dig in. Go to your Humana website and review all of these great benefits that are free for you. You now have the Go365 app and website that you can earn rewards for activities and appointments that you would have done anyway. You can make an account on this website or app and see all of the rewards that are available to you. And of course, the free gym membership that is offered with your plan is Silver Sneakers. If you do have a facility in your area that says they do not participate in Silver Sneakers, give TRS a call so that we can reach out to that facility and see if we can get them on board. Here is the web address for your Humana website. This is specific to our TRS retirees. So go in and walk around for a while. It will help you in so many ways. This website can help answer some questions about your plan as well. You will also have My Humana, a secure online portal with tools to manage your plan and healthcare needs. Numerous calls, emails, and mailings offering additional benefits or add-ons to your current plan can be a serious issue for our members. If you sign up for another Medicare Advantage plan or supplemental plan, or even dental or vision that you may not realize is attached to a supplemental plan, then this will cancel your LMEHP with TRS. Medicare informs TRS that you've chosen another coverage for your health care, and TRS has to cancel your coverage with us. Medicare laws does not allow more than one Medicare Advantage plan or supplemental plan per member. So before you sign up for any additional benefits or the free benefits offered, make certain they are not associated with another plan. Often these plans will offer some free benefits up front, but then their maximum out of pocket a year is much higher than your $1,200, and their deductible is much higher than your $150 deductible. On our TRS website, we have a video discussing this issue, and it is on our videos page and on our TRS Kentucky YouTube channel. I'm sure all of our members are aware of this item by now. Congress repealed the Windfall Elimination Act and the government pension offset. The windfall elimination provision refers to your individual Social Security benefits, and the government pension offset refers to your spousal benefits. So TRS members that qualify for Social Security will no longer have a reduction in those benefits and will be eligible for spousal benefits as well. With the passing of the Social Security Fairness Act, overturning the windfall elimination provision and the government pension offset, a lot of our members are now drawing a larger Social Security check or drawing a check from a spouse in some way. When the check is enough to cover the Medicare Part B premium, that amount will be taken out of your Social Security check. This slide is a reminder for those of you who do not draw a Social Security check in which the Part B premium is withheld, and we encourage you to enroll in Medicare Easy Pay. Unfortunately, we've had a number of members lose their coverage because their Medicare Part B premium was not paid. This is also a good time for those members under 65 to understand that they will have to pay a Part B premium to Medicare once they turn 65.
With the Know Your RX Coalition, we are trying to find ways to better your health and the care you receive. Now you can have free counseling with a live pharmacist. This group is made up of 15 pharmacists from the University of Kentucky, and they can discuss Express Scripts, CVS Caremark, adverse risks of medications, moving up and down a tier, generic versus brand medications, just another great benefit of your TRS healthcare, and they have helped so many of our retirees figure out their medications and cost savings.
Personalized medicine is a three-way partnership with all parties being very important. The Know Your RX Coalition, Coriell Life Sciences, which was recently acquired by Informed DNA, and TRS have come together to bring you this DNA testing. Our OMEHP members on average take 15 prescriptions. So for those of you in that number, wouldn't it give you such peace of mind to know that all of those medications are working for you, are necessary for you, and that there isn't something that may work better? You will take the simple saliva swab test, mail it in, and then they work with your pharmacist and doctors to see what is best for you. It is secure and safe. We do not even get the results of the test here at TRS. Just you, the Know Your RX Coalition, and your doctor. It is also protected under HIPAA and other security measures. DNA testing is available for free to our LMEHP retirees. You will want to contact Coriell either by going to their website at enroll.dnaimpact.com/TRSKY, or you can call 888-454-9024. If you are on the KEHP, this is also available to you. You will want to discuss with your doctor whether a DNA test could be covered because of medical necessity. More and more physicians now use a DNA testing program for their medications. We advise you to speak with your doctor and see if the DNA test would be covered under your health insurance. If it is not, then you can get the DNA test through TRS. And if you are on the CDHP plan, you can use your HRA funds to make that purchase. Or retirees on the KEHP can also contact Coriell.
Now let's look at the Kentucky Employees Health Plan. For retirees that retire younger, they could stay on this plan for 10 to 15 years. It consists of Anthem, CVS Caremark is your prescriptions. Castlight is the website that can compile all of your information, and it's where you'll take your Living Well promise. The Know Your RX Coalition that we've discussed, your Health Equity, and then of course Smart Shopper.
Castlight is a comprehensive digital resource that helps you navigate all of your benefits, plus focus on your health and well-being. During open enrollment, you make decisions that impact your health as well as your finances. Castlight can help with your planning and guide you in the right direction. Live Health Online has proven to our members that you do not need to leave the comforts of your couch to see a physician. You can virtually visit a doctor for your allergies, colds, flus, or even for maintaining your mental health by speaking with an online therapist. Smart Shopper is simply a way for you to put money in your pocket for certain procedures that you have done. From an MRI to a bone scan to larger surgeries like hip and knee replacement. You will put in the procedure and it will give you dollar amounts that you would get if you use certain labs, doctors, or offices for those procedures. I received a $440 check for a colonoscopy that I had to get no matter what, so why not get some money put back into your pocket for those procedures? In addition to your rewards, you also have a diabetes prevention, mental health and stress management, support for kids with learning behaviors or challenges through our Rethink program, also a tobacco cessation program, and help with weight loss and weight management. And then we also have our Hinge Health program. You will need to register for an account on Castlight if you haven't already. The new program year begins on January 1, 2026. There is an online portal, mobile app, and that is where you will take your health assessment. That will save you $40 a month in the 2027 year. You can also connect your Fitbit, activity app on your watch or phone, and many other options for devices and app connectivity. This will allow you to earn up to $200 in rewards for just doing your daily activities and also appointments you have every year. If your spouse is also on your plan, they have the ability to earn up to $100 themselves.
For those members on the Living Well CDHP and the Living Well Basic CDHP, you will get a Health Equity Healthcare Reimbursement Arrangement, or the HRA, which helps reduce costs. Remaining funds carry over to the next year if remaining in that CDHP plan. You can use this card for medical or pharmacy, deductibles, co-payments and co-insurance, and even some over-the-counter products. You can also use this for some dental and vision fees. However, the dental and vision fees do not apply to the deductible or maximum out of pocket. If you go to the website or call the number on the slide, you can also get a list of those over-the-counter products and other things that are eligible to use with your card. You may be surprised at what you can use this HRA card for. When you swipe your card at checkout, be sure to just use credit for it to work without a PIN number.
This slide addresses our turning 65 process. We have members that will contact us and say, I'm turning 65 next year. What do I need to do now, if anything, or do I need to wait until a certain time frame? If you are enrolled in coverage through TRS and turning 65 in 2026, you will receive a turning 65 email 4 months before your birth month. Make sure you have an updated email with us. This is also a great way for us to share important news and updates. TRS will be transitioning to emails from many things, including our newsletters in the future. You still need to enroll in the KEHP to be covered until you become eligible for Medicare, unless your birthday is in January or on February 1st. The reason that we say February 1st would be a January is because if your birthday falls on the first day of any month, you are eligible to move to our LMEHP the month prior. This applies to the first day of any month. Don't include your Medicare eligible spouse or dependent child on your KEHP enrollment if they are already covered in the TRS LMEHP. Those that are already covered in our LMEHP plan do not have to complete anything else each year that we will just continue to roll over. Before you move from the KEHP to Medicare, remember that your wellness program incentive points and your health equity HRA account funds do not continue to Medicare and the TRS LMEHP, so use them or lose them. We want your transition from the KEHP to the LMEHP to be smooth. If you have participated in the wellness program and you still have points left to spend, we want you to know you must spend those before your under 65 KEHP terminates and your LMEHP plan begins. You don't want to lose out on those valuable bucks you have worked hard to accumulate. Also, if you are enrolled in a consumer-driven health plan and you have any HRA funds remaining on your health equity card, you should lose those funds before moving to the ILMI HP. If you do not use them, they will stop when you start your ILMI HP program.
Your Pathway portal is a great way to look at your information with the teacher's retirement system and probably allows you to do more than you even realized. You can review your retirement account or an active account. If you are a return to work member, as soon as you sign in, it asks you which account you'd like to look at. So that way you can see how many years you're building up in your second or third retirement account. You can review your pension check. You can update your address, tax withholding, beneficiary information, bank account information. You can manage your health insurance. If you're ready to enroll in the ILMI HP when you gain Medicare, you can do that on Pathway. And you can also enroll or terminate with a qualifying event. We have recorded versions of many topics on the TRS Kentucky YouTube channel and on our TRS website's videos page. Useful topics for retirees are pathway registration, return to work, retiree health insurance, turning 65. It also answers a lot of common questions and has many videos that could help you. These can help you navigate many life events and the processes they involve. So always look to our website or YouTube channel as you approach those times. And here's how you can follow TRS online. We're on Facebook and X, formerly known as Twitter, as well as the TRS website and Pathway. Those links are listed on this slide. We want our members to stay informed. TRS does not send out junk mail. You can call our information center, check our website, and always watch for our newsletters. Please try to read those newsletters and watch for any updates we might announce. Also, Pathway is your online access to your TRS account. If you want to access your personal account, you must register. If you are a first-time user, you will need your TRS ID to register for the Member Self-Portal. That ID is on your annual statements or any personal mailings we send out to you.
Just remember to call TRS if you have any questions or concerns. You can also email any questions to info@trs.ky.gov. We now see members by appointment to try to avoid what can be long waits when we have a packed lobby. I appreciate you taking the time to listen to this important insurance information today. And as always, thank you for being a Kentucky educator.